When patients are missing multiple or all of their teeth, there are options for replacement, and all tooth replacement options can be broken down into two categories. There's what we refer to as fixed options. These are teeth that do not come in and out. And then there's removable options. These are going to be teeth and tooth replacement options that are removed on a daily basis for cleaning and oftentimes for sleeping. And both of these options can be with or without implants. The most common option that patients are familiar with when you need to replace a full set of teeth are going to be complete dentures. Teeth that come in and out meet a lot of patients' needs. A lot of patients are very satisfied, and a lot of patients enjoy being able to clean with teeth that come in and out at night. But some patients do not want to put their teeth in a cup while they're sleeping. Some people do not want to die with their teeth in a cup. So having teeth that don't come in and out offers a tremendous psychological benefit to most patients. It's a sense of being restored to where you were, before you suffered from dental disease. So with 4 to 6 implants, we can create something that does not come in and out. What most patients can expect if you're missing a set of teeth, a whole arch of teeth, and you'd like to have them replaced with dental implants is that after meeting with us and getting to know us and us getting to know you, knowing about your medical history, what your anesthesia needs are, after taking the appropriate records, then we'll typically schedule a time to do the procedure. And we will place the implants, and then if possible, we will secure temporary teeth to these implants. These teeth are not going to be removed for the whole healing process, which is going to be about 4 months. And then after 4 months, the permanent teeth can be made out of a more durable material. And typically, patients can have more say at that point as to the shape of the teeth, the color of the teeth, and the positioning of the teeth. So upon completion of treatment, what most patients can expect is to be able to eat the foods that they want to eat, foods that they may have not been eating for a long time. They can expect to be able to be intimate with their spouse or partner in a manner that they haven't been able to do for a long time. Their smiles will look better than they've looked in a long time, and they'll have security and confidence to go out and face the world.